In 1997, well-known actress and vocalist Julie Andrews underwent surgery to remove bilateral vocal nodules from her vocal folds. Unfortunately, the physician botched the surgery, leaving her unable to sing again, and she lost her 4-octave soprano voice, and she fell into a deep depression. So this is a fear for many professional singers today. Common symptoms of nodules include hoarseness, breathiness, pitch breaks, and difficulty singing at a soft volume. As speech-language pathologists, it is important for us to be able to advise our patients on the best treatment for vocal nodules so they can safely continue their art. Luckily, there are many options one can consider as an artist to heal their vocal nodules, including phonomicrosurgery done by surgeons, voice therapy done by a speech-language pathologist, and vocal pedagogy, voice lessons on healthy singing habits treated by professional vocal coaches. And as you can imagine, treating a singer with vocal nodules is a team effort. This team may include the singer, physician, laryngologist, voice therapist, vocal teacher, and other caregivers. They all must have a collective understanding about the best treatment for vocal nodules so that they can coordinate to administer the best care for the singer to achieve excellent results. So the first study I'm going to talk about tested the hypothesis that non-surgical treatment, voice therapy, and elimination of incorrect singing is sufficient for the disappearance of vocal fold nodules. 28 classical singers with vocal nodules, some with soft, small nodules, and some with hard nodules, were examined for up to 24 years after establishing their diagnosis. And this study concluded that vocal fold nodules tend to reoccur despite non-surgical treatment and voice therapy. Physiologically correct singing and voice therapy leads only to a temporary disappearance of soft, small nodules and does not promote resolution of harder and larger nodules. And another study that I'm going to talk about, which was a systematic review, compared surgical versus non-surgical treatment of vocal fold nodules in a variety of populations, including singers, and they aimed to determine which intervention led to improvement of voice quality and quality of life. So, for example, returning to a professional singing career without any symptoms. However, after reviewing a number of studies, they did not find enough evidence to compare surgery to other treatment options. A lot of research is subjective, and that some singers like the vocal quality that vocal nodules give them, like a hoarseness. Also, there's no consensus as to which of the techniques employed by speech therapists and voice therapy is effective or for how long it should be used and conducted. In addition, they found that there's a general consensus that surgical treatment of vocal nodules should aim at removing the minimum amount of mucosa on the vocal fold so they can safely return to singing. Additionally, the role of post-operative voice therapy is unclear, claiming that reoccurrence is more likely without post-operative therapy. And another study that I'm going to talk about aimed to evaluate objective and subjective changes in the voices of adults with vocal fold nodules who received resident voice therapy done by speech-language pathologists. 26 female patients who had bilateral vocal fold nodules and 30 healthy women were included in this study. And out of the 26 patients, 23 of them had regression or partial regression of their vocal nodules using resonant voice therapy. They found that resonant voice therapy improves objective and subjective parameters, including fundamental frequency and maximum phonation time of vocal function in patients with vocal fold nodules. And another study I'm going to talk about evaluated the efficacy of phonosurgery, logopedic voice treatment, or vocal pedagogy in organic and functional voice problems of singers. They found that all three subjectively and objectively were effective in improving the impaired singing voice. However, phonosurgery had the largest numeric impact on improvement of vocal function. Another study found that voice therapy resulted in the resolution of symptoms of nodules in nearly half of the patients, saving these patients from an operation. But they talked about that when voice therapies fail, surgery should then become an option, and the vocal nodules must cause dysphonia severe enough that the singer can no longer perform before considering surgery. So after reviewing this research, the general consensus is that the best treatment option is still inconclusive. The most effective form of voice therapy has not yet been established, neither has the duration of how long treatment should last. However, because of risk, there's a general consensus that voice therapy should be targeted before even considering surgery. And voice therapy seems to be the best option and the way to go for singers with small and soft nodules, considering research has proved partial to full regression of the vocal nodules using this technique. On the other hand, severe cases of hard vocal nodules that do not resolve after voice therapy should be reserved for surgery. And additionally, conducting research on singers can be really tricky because patient compliance is a common problem in voice therapy, and that it requires several visits to the therapist, performance of daily exercises at home, and maybe even vocal rest. And because many patients are career vocalists, reducing vocally damaging behaviors and voice rest and visiting a therapist can be really problematic to their careers. Something else I found interesting while doing this research is that the overwhelming majority of subjects in these studies were women. That is because women are more susceptible to vocal nodules due to hormone-related changes in the larynx while they are menstruating. This is important because we can advise our female patients to take extra precautions on vocal health during menstruation. So, we turn to the rules of evidence-based practice to make our decision for which is the best treatment. What does the research tell us? Well, it's inconclusive, but I think there's a general consensus that surgery is the choice with hard nodules after already trying voice therapy, while voice therapy may be sufficient enough to decrease the size of small, soft nodules. And next, we turn to our expertise as speech-language pathologists. It is important for us to be familiar with the anatomy of the vocal folds, risk of vocal nodules, symptoms of nodules, therapy techniques, and the latest research so that we can inform our patients with the most appropriate information and give them the highest level of care that we possibly can. And finally, what is the performer's preference? Do they like the raspy quality that their vocal nodules give them? Are they too afraid of surgery and that it may damage their vocal folds like Whitney Houston? Taking their preference into consideration is incredibly important, considering this can greatly affect their career and their art. Thank you.